My name is Rachel, and today I'm going to talk to you about tobacco. Specifically, I'll be addressing what tobacco is, the history of tobacco, and the different uses of tobacco. I'll also talk about how tobacco has transformed over time, from how it became to this to that. So, first of all, what is tobacco? Most of the time, when asked that question, the majority of people are going to think of a cigarette. And you're not wrong. Cigarettes are the most commonly and widely known use of tobacco in today's society. However, I'm going to go into a little bit more depth of that and talk about truly what tobacco is and where it comes from. So, tobacco is an agricultural crop. This crop is typically grown on tobacco farms by tobacco farmers. It doesn't always have to be grown by a tobacco farmer on a tobacco farm. You can get it yourself and grow it in your own backyard and manifest it that way. But most of the time, when you're walking down the street and you see someone using tobacco, most of the time, that tobacco was grown by a tobacco farmer on their tobacco farm and then sold in the stores. So, what is tobacco and why do people like to use it? Well, first of all, the leaves of tobacco contain levels of nicotine. Nicotine is that chemical that gives people that buzz when they partake in using tobacco. So, nicotine can temporarily affect your brain function and eventually permanently affect your brain function. Now, what do I mean by that? Well, temporarily, nicotine can improve your mood and concentration, decrease any symptoms of stress or anger. It can also relax your muscles, even reduce your appetite. Now, this is totally proven because I know we've all been in situations where we've heard someone say, I need to step outside and have a smoke break. And that's because they're probably feeling a little bit stressed, and that cigarette will definitely decrease any symptoms of stress or anger that they're currently feeling. However, over time, the more people use tobacco, and once their tolerance increases, dramatic changes can take place in their brain. So, when was tobacco introduced to America? Well, first of all, tobacco had been used for many, many years before our country even knew about it. But according to Boston University Medical Center, it is believed that tobacco began growing in the Americas about 6000 BC. So, if you think about it this way, 6000 BC is when tobacco first started growing in America. And before that, tobacco had been around for many, many years. So, tobacco has been around for an extremely, extremely long time, way before any of us were even born. So, prior to 6000 BC, American Indians used tobacco for medical or religious purposes. It was believed that tobacco had many first aid healing properties. And then, when tobacco finally made its way into Europe, thanks to Christopher Columbus, the Europeans also viewed tobacco as a medicine for their lives. Over time, tobacco eventually became the best and greatest thing in the 1600s, and oftentimes people would use it as money. For example, everybody wanted tobacco. Everybody wanted it. It was basically what candy is to a child. So someone would trade tobacco for another good instead of money because that's how valuable it was. If someone was in tobacco, they could really care less about money. They just wanted that tobacco and they would do anything to get their hands on it. However, tobacco did face many legal and financial issues throughout history, all the way from 1000 BC, and even today we see financial and legal issues with tobacco. Back in the day, especially during times of war, these issues were very prominent. They were dealing issues such as should tobacco even be legal because of the addictive properties of it, and what should we put the cost at? So eventually, tobacco made its way everywhere around the world and grew extremely popular in the form of cigarettes, cigars, electronic cigarettes, and chewing tobacco. So now that we have a better understanding of the history of tobacco, we can now talk about how the use of tobacco has developed over the past few years. Over the years, as technology has developed and ideas have manifested, different forms of using tobacco has also manifested. So, like what I said at the beginning of this video, when asked what tobacco is, most people would probably say cigarettes. And like I said, you're not wrong. Cigarettes have been around for a very, very long time. It is the most common use and widely known use station or any convenience store, and Juuls are going to be a little bit more cheaper than e-cigarettes because they do have that salt nicotine. Then we also have tobacco dip and tobacco snuff. Tobacco dip and tobacco snuff aren't new. They've been around for a very, very long time. Back in the day, tobacco dip and tobacco snuff was very popular in Western culture and country culture, and that's probably why even today we see a lot of men in boots that use dip rather than smoke a cigarette, and I'm not really sure why that is, but it is definitely a thing in our society. So what is tobacco dip and tobacco snuff? Both dip and snuff are finely grated and placed in either your lower lip or upper lip, just depending on whichever form you're using. So now that we have a better understanding of the different forms of using tobacco, I do want you guys to understand that they all provide the same effect, which is the nicotine high that I mentioned in the beginning of this video. So now that I discussed what tobacco is, the history of tobacco, and the different ways to use tobacco, we're now going to go into more depth of how the harmful effects of tobacco can really affect your body and cause damage over time.
Hi, my name is Lauren Garber, and I'm going to be talking about the effects of tobacco smoking on the individual, on those that surround the smoker, as well as the community at large. So our cities, our states, our countries, and even the entire world. So first I'm going to start with the individual. So I'm going to break each one down into short-term and long-term effects. For short-term effects, we're going to have some social effects as well as some physical effects. So for the social effects, we have bad breath and overall just smelling like that tobacco smell. This doesn't seem like it would be that big of a deal, but a lot of smokers report having issues making friends or dating people who are non-smokers because they just don't like how it smells. They don't like the person, harming themselves in this way. So that's just something to note. But more importantly, they're going to start to experience a little bit of fatigue and lack of energy, and that's going to happen in the first few weeks of picking up the habit. They start to notice that, and that's going to come along with shortness of breath. So you're going to notice this in the form of being at work and you're trying to walk up the stairs, and normally it's not that hard, but it's getting harder and harder even though you've been doing it for years. You're out of breath at the top, that kind of thing. In addition, you're going to lose a little bit of the ability to taste and smell, just slightly, and you're going to notice this over the first month or two. And then the most marked thing is coughing. So coughing is definitely a long-term effect as well, but in the short term, if you start to notice some coughing, that's how you're going to be able to determine someone who's been a smoker for a little bit and who just picked up the habit. So once you start to cough, that's when you're kind of leading into those long-term effects. Long term, we're going to have a higher heart rate. So this is actually a resting heart rate. So I work as a personal trainer, and I've worked with a few clients who either are current heavy smokers or were heavy smokers in the past. And a big issue that I saw in that population was just an elevated resting heart rate. So someone who looked normal sized, seemed healthy otherwise, but when I would take their heart rate, it would be almost as if they were exercising and they were just sitting there. And what this means is that those blood vessels are restricted a little bit from the heavy smoking over time, and it causes that blood from the heart to have to pump so much harder and work so much faster to get the blood to the extremities than it would if you just weren't smoking at all. Or you'll also see this higher heart rate in someone who's inactive, but inactive and smoking are two really good indicators of a higher resting heart rate. In addition, that coughing from before is going to get elevated, it's going to get much worse. It can lead to asthma, it can also lead to emphysema. So these are all lung issues with breathing and coughing. Lung cancer, which we all know about, that's the big thing that people use to scare people from smoking, and for good reason, because lung cancer is a huge issue for smokers long term. So then there's also women and men, they experience fertility issues. So women can experience difficulty actually conceiving a child. So that's not talking about when they are pregnant, if they're smoking, what could impact the child. We're talking about just getting pregnant in general is really hard for smoker women. And then for men, they actually can experience erectile dysfunction when they previously didn't have any issues with it at all, which I found kind of interesting. In addition, at least half of smokers that are long-term smokers end up dying due to smoking. And this is usually due to lung cancer or some type of chronic illness that is caused from the tobacco smoke. So secondhand smoke relating into how it affects the people around the smoker. So secondhand smoke is defined as when an individual who does not smoke lives or is often near a smoker and is exposed to the carcinogens and chemicals that are exhaled from a cigarette. And this can be repeated exposure in the case of a family that's surrounded by the smoker, or it can be just, you're walking down the street and someone's smoking a cigarette and you're breathing in what they're exhaling. So that'd be more of a mild version of secondhand smoke. And who does it affect? So secondhand smoke can affect absolutely anyone. Like I said, if you're walking down the street, you can be affected by it every day. It just depends on where you live and how common it is to be smoking outside where you're spending a lot of your time. But it heavily impacts pregnant women, children and babies, the elderly, and those with respiratory or heart problems that are already pre-existing conditions. The most at-risk populations, however, are pregnant women and then children and babies. So the short-term and long-term effects of tobacco smoke on those that are immediately surrounding the smoker, so friends and family, are in the short term, it's just the smell of the smoke and the annoyance. So it's kind of how I talked about the short-term effects for the smoker. It's going to impact their ability to date, but it's also going to impact how their family feels. If they don't like how it smells, if they don't like that kind of thing, if they know that it's going to hurt the person, it's just going to annoy them that it's constantly around. And this isn't necessarily something that's going to impact health, but it's definitely a huge part of smoking that people don't talk about a lot. And in the long term, basically the same symptoms can occur to the friends and family that occur to the smoker, which is really scary because we don't think, we're not inhaling the cigarette smoke, so it might affect me a little bit, but it's not going to do much. But in some cases, it can actually be worse than for the smoker. So they can experience heart problems, excessive coughing, asthma, emphysema, lung cancer, restriction of those blood vessels, just like the smoker will in the long term. So we said that our most common populations to be affected were pregnant women and then babies and children. So in pregnant women, it can actually lead to an ectopic pregnancy, which is that pregnancy that it falls outside of the uterus, which a baby can't survive through an entire pregnancy outside of the uterus. So it can really affect the whole birth process. Rupture of the placenta mid-pregnancy, premature birth, stillborn baby, and birth defects. So these are all horrible effects of secondhand smoke. And previously we always thought of these effects happening to pregnant women who were smoking. But like I said, the impacts of secondhand smoke versus direct inhalation are almost the same. So these same effects can happen to a pregnant woman who isn't smoking, that's just next to a smoker. And then for babies and children, it's the same kind of deal: excessive coughing, asthma, bronchitis, pneumonia. And the big thing to note with children and babies is that while they're going to experience the same symptoms that an adult would, they're going to experience them at a much more amplified level because they haven't developed that immune system that an adult has yet. And so especially for babies who haven't been to school and built up their immune system in any type of capacity, these effects are going to hit them so quickly as opposed to an adult who has been exposed to things growing up. And lastly, we're going to talk about the effect of tobacco use on the community. So there's tons and tons of effects of tobacco use on the community, but I'm going to focus on littering and societal cost. So for littering, the first thing I want to talk about is just the aesthetic appeal of a city. So we know that our big metropolitan areas, we've got Los Angeles, Houston, Dallas, Chicago, New York, those big cities, they are littered with cigarette butts. They're everywhere. It's not attractive. It's not appealing. It brings down the overall beauty of the city. And again, while this isn't something that's going to directly impact our health, this is something that directly impacts our cities and how they look and how we keep up with them. And we have to pay someone to come by and clean those up every time. So something to think about. But more importantly, we have that they contaminate the groundwater and soil. So this is huge because people don't think about it when they're throwing their cigarette butts out the window of their car or when they're walking down the street. But this gets into the soil where we grow our vegetables and fruits and feed the grass to the cows and we eat that food. that is grown by these contaminated soils and waters. So the fish are also getting impacted by the groundwater being contaminated by cigarettes. And I think it's just something that we don't really think about, but it affects the whole circle of life when these cigarette butts are just being thrown everywhere. And even in drier areas like California, it can cause fires. So people are throwing their cigarette butts and they're still lit a little bit and it can cause fire. And then the societal cost is the biggest impact. So between 2009 and 2012, we actually saw a decline of cigarette smoking, at least in the United States. However, we still spent over $289 billion as a society in the United States on cigarette smoking. So this isn't counting the world, this is just America. And the different costs were associated with healthcare, missed work, and premature death. So the biggest one obviously being healthcare. However, one thing we don't really think about is the impact that it has on missed work. So this is including when someone goes outside to take a smoke break, the amount that they're costing the company by going outside, as well as the cost that they're causing when they're having to miss work for healthcare reasons. So it has a much larger impact than I think we realize.
There are many reasons that it's important to quit smoking. Today we're going to be focusing mainly on the health benefits of quitting. Within 20 minutes of quitting, your heart rate and your blood pressure will decrease to a normal level. This is the first health benefit of quitting cigarettes, and it happens very quickly. Between 1 to 9 months, you'll notice that it's easier for you to breathe and you'll be coughing less. These benefits are something that you'll be able to tell on a daily basis that they're affecting you. Whenever you get to the year mark, it starts dealing with disease. So the risk of your coronary heart disease is cut in half 1 year after quitting. At 2 to 5 years, you'll have the risk of smoking-related cancers is that of a non-smoker. So that would be cancer of the mouth, of the esophagus, of the tongue, things like that. They will be as if you hadn't smoked. And then all the way up to 15 years later, your risk of coronary heart disease is also that of a non-smoker. So from 1 year to 15 years, these are dealing with diseases that could potentially take years off your life, and your body is healing itself back to how it was before you even started smoking. Some other reasons to quit that aren't the health benefits would be, for sure, the money that you save. So if somebody smokes a pack a day, that would average out to about $200 a month. So that is a very large amount of money per month that you would be saving. It's also, you will be able to spend more time with your friends and family. You won't have to leave for smoke breaks or anything like that. So you'll be able to just have more quality time with them. So moving on to the next slide, how to effectively quit smoking. So there are a few ways to do this. You can either cut back on smoking or you could stop cold turkey. Now, withdrawal would definitely be worse for the people that stop cold turkey, but also cutting back, you may not actually end up fully quitting. So it's important to know your smoke triggers and you have to avoid them. So, for example, if you go out to a bar every weekend and you always smoke there, you might not be able to go back for a while because you won't be able to go and not smoke. It'll just make you want to have a cigarette. So another thing you can do is to change up your routine. So say you are walking outside and you're walking to work and you just start craving a cigarette. You can pop into a store or a cafe, just get a drink, just do something to distract yourself so you're not tempted. It's also important to prepare for your cravings because you know that they're going to happen, so you might as well just come prepared. Bring a snack, maybe something healthy, so that you still have the oral fixation of putting something in your mouth, like if you were smoking. And so then you can kind of try to curb your cravings like that and replace your cravings so that whenever you start to crave a cigarette or smoking, your brain will associate it with whatever healthy snack you normally bring. It's also important to just keep thinking about how much money you're saving. Money is what this world revolves around, and so it's it's something that you wouldn't be missing spending all that money. It's also super important to ask for help, ask for support, whether this is from your friends, your family. You can, if you just Google quit smoking, there'll be a million websites that'll come up where they have live chats that you can talk to them and just figure out the best ways for you to quit, and they'll have such great advice for you because that's what they're there for. And there's actually strong evidence that somebody that asks for advice or gets assistance, it's more effective in promoting quitting smoking attempts, and it also will motivate an additional 40 to 60% of people that smoke to quit whenever they're offered help. So those are a few ways on how to kind of get around smoking and effectively stop smoking. So even though you can effectively quit, there will be side effects, which is partly what makes it so hard to stop smoking. And these are the nicotine withdrawals, and it can present itself in a bunch of different ways. The most common would be sadness, irritability, trouble sleeping. People often feel sick, like they feel like they have the flu or a cold, and these can last a few days, but they can also last a few weeks, and this is whenever relapse is at the highest risk, and it's so important not to relapse during this time because it'll just extend the time of your withdrawals rather than just sticking through it for the first few days or weeks or however long it is, because if you continue to relapse during these withdrawals, it'll just push it back to months and months rather than just being a few weeks or a few days. So it's super important to, at that time, just whenever you commit to quitting, just fully commit, and don't push it off and don't continue to relapse. So there are some ways to make these withdrawals a little bit easier on yourself. So a main type is called NTR. I'm sorry, I said that wrong. NRT, nicotine replacement therapy. And this is probably the best way to overcome withdrawal. So you can use nicotine replacement therapy either with over-the-counter products, or you can go to your doctor and get a prescription. So the over-the-counter products are like the nicotine patches and the nicotine gum. You'll often see commercials for them, and it puts some nicotine into your body so that you personally don't feel the withdrawals, or you don't feel them as bad, but you're not still smoking. So it's still making it easier to quit because you're also breaking the habit of smoking, which is also something that's difficult to do. So this is breaking the habit, and it's just putting a little bit of nicotine into your body just to overcome the withdrawal, but not to give you like the buzz of nicotine or anything like that. And then the prescription types of NRT would be nasal spray or an inhaler or something along those lines. Other ways to overcome this is by going outside and taking like a 10-15 minute walk. Anything to distract yourself and keeping yourself active is good. It's important to, earlier I mentioned that like preparing for cravings by bringing a snack. Well, it's super important to stay away from unhealthy snacking because nicotine is an appetite suppressant. So if you replace that with an unhealthy food, it will result in weight gain. But another way to suppress your withdrawal symptoms would be to call a friend, again, go on a walk, just anything that's going to be able to take your mind off of smoking and just put it somewhere else for a little bit until you can get over that craving, and then you'll be better.
Hi, my name is Erin, and today we are going to be covering chemicals in tobacco products and nicotine addiction. To begin discussing chemicals in tobacco products, you must know that there is a difference between smokeless tobacco and smoking tobacco. With that being said, they do have a couple chemicals in common, such as arsenic and formaldehyde. Arsenic is often found in rat poisons, and formaldehyde is often used to embalm the dead. Today, we are going to be focusing on smoking tobacco, specifically cigarettes. Breaking down smoking tobacco. When it comes to cigarettes, there are 3 developmental stages: farming, Manufacturing and consumption. During each of these stages, there are chemicals that are being added or created to the product to enhance it for the consumer. This process makes cigarettes harmful to the consumer and to the people around them more than smokeless tobacco. Farming tobacco. During the farming process of tobacco, we know that chemicals are being introduced to the plant by geographical location, fertilizers, and curing. We also know that tobacco plants naturally contain the chemical nicotine. Well, picking a location for growing a tobacco farm is important because the location you choose to grow your farm introduces chemicals to the plants that didn't already exist within it. We know that soil introduces heavy metals like cadmium and lead that damage the lung tissues, kidneys, your liver, the blood, and your bones. We know that fertilizers introduce nitrates that build up in the plant by the end of the growth. And to get the plants ready for manufacturer use, they go through a process of curing, which introduces tobacco-specific nitrosamines, which is a group of carcinogens that affect the lungs, pancreas, esophagus, and oral cavities. Manufacturing tobacco. During the manufacturing process of tobacco, we know that chemicals are being introduced to the plant to enhance taste, control moisture, and mask the harshness of smoke. Chemicals like ammonia are being added to the tobacco plant because it increases the nicotine absorption by creating free nicotine molecules from bound nicotine within the plant. Sugars are added during this process to mask the harshness that smoke causes on your tissues of your oral cavities. It also ensures that the consumers are going to continue to purchase these products. Usage of smoking tobacco. During the consumption of smoking tobacco, when a cigarette is lit, a chemical reaction is created. The outcome of this are new chemicals that are being introduced to the consumer. 4 of these chemicals are carbon monoxide, 3-butadiene, acrolein, and benzene. Carbon monoxide can be found in car exhaust, along with acrolein. 3-butadiene is linked to causing cardiovascular disease. Acrolein can also be found being released from fires. And benzene is found in rubber cement and gasoline. The one thing that all these chemicals have in common are that they're carcinogens. Not only are these 4 chemicals known to be carcinogens, there are 70 other chemicals that are also carcinogens during this process. It is important to know because the people who smoke leave secondhand smoke around, which introduces these chemicals to people. I'm going to be covering 4 major reasons why nicotine addiction persists. To start off, I'm going to be focusing on the brain and neurotransmitters that are released. When you begin smoking, nicotine is absorbed through the lungs and travels into the pulmonary venous circulation, which then moves up to the brain and binds to nicotinic cholinergic receptors. It then triggers the release of dopamine and gamma-aminobutyric acid. The release of dopamine occurs in the ventral tegmental area of the midbrain in the nucleus accumbens. The nucleus accumbens has the role of giving the consumer a feeling of a reward and pleasure. Dopamine also increases the absorption of nicotine, whereas gamma-aminobutyric acid, aka GABA, inhibits the release of dopamine. When this reaction occurs and persists, the exposure to the nicotinic cholinergic receptors will become desensitized over time, and the neurotransmitter GABA will have no effect. This will only enhance the responsiveness the consumer has to nicotine, and is the reason why that these neurotransmitters that are released has an effect and will continue to cause an addiction to nicotine. Aside from looking into the brain and why nicotine addiction persists, the symptoms from nicotine and conditioned behaviors play a role in why it continues. When smoking, the smoker may often experience a control of arousal and mood It reduces stress and anxiety. It induces pleasure and improves concentration, reaction time, and performance. It can also help with relief from withdrawal symptoms, but that comes into play later. Conditioned behaviors play a significant role because you become used to your daily activities and routines that you have, and when you are trying to quit smoking, it may throw off the rest of your day until you perform that activity. And in this case, that activity is smoking. For instance, an example of conditioned behavior would be smoking every day with a cup of coffee in the morning or smoking after every meal. These are examples that can be hard to break and why you may relapse. Another conditioned behavior that chronic smokers may experience are cues. Cues are triggers that occur in your daily life that make the individual want to smoke again. Like mentioned earlier by Emma, quitting smoking, especially if you are a chronic smoker, you may experience withdrawal symptoms. These symptoms may include feelings of sadness, irritability, trouble sleeping, and feelings of being sick with the flu, and much more that can cause an individual to want to relapse. Emma mentioned that in this time you are sensitive to relapse, and I think this is because of the situations that you're placed in, whether it's bad or sad, and usually your reaction to this may be to cope with it by smoking because it relaxes you. And these are just like some of the many reasons why these conditioned behaviors are hard to break. But also experiencing these symptoms make you feel physically bad, and knowing that having a cigarette can help you reduce these feelings and help you cope better with the situations, make it harder on the individual to quit. And these are reasons why nicotine addiction are hard to break. Lastly, nicotine addiction occurs because of an individual's vulnerability. Their vulnerability may include smoking at an early age, peer or parental influences, behavioral problems, personality characteristics, genetic influences, and mental illnesses. Beginning to smoke at an early age leaves you more susceptible to developing a dependence to nicotine. Peer and parental influences play a role because you may have been peer pressured to smoke at an earlier age as well, or your parents' situation at the house isn't that well, which also plays along to behavior problems. You may use smoking as a way to help cope with the situations that you are faced with. They can help you to relax and control your moods as well. Personality characteristics and genetic influences go hand in hand with each other, because if you have an addictive personality, or if your family is known to have an addictive personality or a history of addiction, that can leave you susceptible to developing a nicotine addiction, especially if you consider using tobacco products in the future. Mental illnesses play a role because nicotine symptoms help relieve stress and anxiety and can help you to control your mood. So if you have a mental illness, you may use nicotine to help cope with that illness that you've been diagnosed with. So brain mechanisms, nicotine symptoms, conditioned behaviors, and vulnerability of an individual are all reasons why addictions continue to persist.